Hi everybody, I am Thatnursingprof and welcome to my channel. In today's video, we're going to be talking about all of the things you need to bring with you for clinical. So the first thing, the most important thing of all, right, is your stethoscope. So you definitely need to bring your stethoscope with you to clinical. And then this stethoscope holder I got this on Amazon. It was under $20 and it comes in lots of different colors. I just love it. I think it's super cute. So if you want something like this, I would go ahead and check that out. If you don't want something like this, something this fancy and you just need something simple, you can put your stethoscope in this. It's the perfect size, it's lightweight, and I got it at the Dollar Tree. So this is also an option to hold your stethoscope. Another important thing you need to get is a badge reel, okay? I know sometimes in school you have lanyards. Not every facility is going to allow people to use lanyards. They're going to require a badge reel. So go ahead and get one of these if you don't have one yet. White shoes. Let's talk about white shoes for a sec. So almost every school will require you to have white shoes. There will be a variety of what is acceptable depending on your school. So a lot of schools will say it needs to be like a sneaker, it has to have a closed toe, you can't have, an open back. So a lot of nurses' shoes that are like clogs or mules or Crocs, some of those are not acceptable in school. So you need to know your school's policy. This one is my shoe, and this one's okay for the school that I work at. But when I went to school, this shoe would not have been acceptable because it has this pattern on it and it's not completely white. So you gotta be familiar with the requirements of your school, but you're gonna need white shoes. You might have to do dosage calculation, so a little calculator like this is a handy thing to have. You're not going to be able to use your phone in the clinical setting, so having something like this, it's super lightweight. Again, the Dollar Tree, so very inexpensive. You can keep it in your pocket, it fits perfectly. It's a nice calculator to have. Writing utensils. So you're going to need a black ink pen. Some places when you chart, if you are actually allowed to chart in the real chart and it's not a computer chart, they want you to do it with a black ink pen, no other crazy colors. And if you have assignments due during clinical, your teacher is probably going to want you to turn them in a black ink pen. A black ink marker like a Sharpie, those are good too, because maybe you're doing a dressing change or maybe you're noticing drainage on a dressing and you need to circle it. The pens don't always cut it. The pens aren't always as good in that situation. So using a marker is going to be really helpful. You're going to want to bring a pair of nursing scissors, and they come in like a million different patterns. You can get them plain, you can get them with hearts, whatever. So you're going to need a pair of these for like taking off dressings and things like that. And then another thing I recommend is hooking it up to your little badge reel. That way you don't lose it. Usually what I did is I had two badge reels. I had the one with my ID on it here, and then I kept the scissors on the badge reel in my pocket so I could just pull them off, use them, and then I didn't lose them. You're going to want to bring a pen light and get one that has the little pupil gauges on it for reference so you know when you're looking at it like, oh, that's 3 millimeters, that's 5 millimeters. So that's just helpful. Also, if you have long hair, I recommend just throwing a couple of extra ponytail holders in your bag because you never know when you're going to need one. They break, you lose them, it happens. So having one available just in case is a good idea. A clipboard. And I really like this one. This one's really fun because it folds and it can actually fit into your scrub pocket. So getting some sort of clipboard to organize all of your papers and organize all of your notes is going to be really helpful. You also might want to get some loose leaf paper too, just to jot notes on, or sometimes your teacher will say, okay, for your assignment, I need you to go do a head to toe and I need you to write it out for me and chart it this way. We're not going to chart it, officially in the real chart. So having loose leaf paper on hand, just in case you're assigned things, is really important. You want a separate bag for clinical. So the bag you use for lecture is your lecture bag and your clinical bag is your clinical bag. That way you don't get things mixed up, you don't lose things, misplace things, stuff like that. You want to watch with a second hand. It doesn't need to be particularly fancy, and in fact, I would recommend not wearing a fancy watch to clinical. Wear like a very simple plain watch. And if you're not somebody that wears watches regularly and you're like, oh God, I'm gonna forget about it, this is what you do. You put your watch on your clinical bag. That way you don't forget it. It's there, it's already there. So that's just my little tip about watches. So this one I'm not going to show you, I'm just going to recommend to you. Some schools, their uniforms, their scrubs are white and they're basically see-through. They're very transparent, especially those scrub pants. So I would recommend getting yourself some nude underwear just in case. You might be wondering, do I need to bring any books to clinical? Which ones do I need to bring? So the first one you need to bring is your drug guide. Now I know there's lots of apps and things like that you can download. But again, you're not going to be allowed to have your phone. You're not going to be allowed on your phone. So you do need to have the actual book, the drug guide book. Another book you're going to need is your NANDA book, your nursing diagnosis book, because you're going to be writing care plans, right? So you're going to be able to look that information up right away because you're going to have your NANDA book. Another book I recommend is the lab values book. So when you're looking at your patient's chart and you're seeing stuff and you're like, I don't know what that is. They had a D-dimer. What's a D-dimer? What's a normal range for that? You can look that up in this book. And then finally, the big one, the big heavy one, your textbook. You should bring your textbook because you might need to look up information in your textbook. You might not always be allowed on the computers. So having your textbook is going to help. So I know you're probably thinking, oh my God, I have to carry all of those heavy books with me to clinical every week. That's going to be terrible. So this is what I recommend. I recommend getting in your little group with your clinical classmates and saying, I'm going to be the one that brings the textbook. You can be the one that brings the drug book. You can be the one that brings the lab book. That kind of thing. So you're not all carrying the same books all the time and it's not so heavy and you guys can just share with each other. That's what I would recommend to make it a little bit easier on you. A little notebook like this is going to be really helpful too, not just to take notes on your patient, but to take notes on other little things that you don't think about, like what's the password to get into the supply closet? If I need to call dietary to change my patient's diet, what's their phone number? So writing down important passwords and numbers, your sign-on to the computer, right? That kind of stuff, this is going to be really helpful to keep this with you, and it's small and lightweight and fits in your pocket. So I really recommend getting one of these as well. So that was the must-have list. I want to give you a quick little maybe list. And it's really going to depend on where you're having your clinicals and what type of clinical it is. So some things you could potentially need would be a pulse ox, your own personal pulse ox. If you're in the hospital setting, they're probably going to have this available to you. It's probably going to be connected to the whole vitals machine and all of that. But if you're in like a nursing home setting or assisted living setting, they might not have this, or they might have one and they only have the one for the whole floor. And if the nurse is using it or somebody else is using it, you won't have access to it. So having your own, this might be something nice to have. And these are pretty inexpensive as well. A blood pressure cuff so that you can do manual blood pressures. This is going to vary by your clinical location and your instructor's preference. Some instructors do not want you to use the electronic vitals machine. They don't want you to use that blood pressure cuff. They want you to take manual blood pressures. So making sure that you have the supplies you need in order to do that will be helpful to you. And then the final, maybe you'll need it thing is a reflex hammer. So you can get a reflex hammer to do your patient's DTRs. This is a really nice thing to own. But if you don't have one of these and you need to do DTRs, you can use your stethoscope. So taking this part, the bell and the diaphragm of your stethoscope, and using this as your hammer, that's kind of like a little hack if you don't have one of these available. So those are the maybe things. I also wanted to talk about some things that you shouldn't bring with you to clinical. Mainly expensive things like your computers and your tablets and that kind of stuff. You're not going to be able to use them anyway, so do not bring them. Likely, there's going to be some random conference room where they have you put all of your bags and coats and things like that. It's probably not going to be locked, and you're not going to be able to keep your eye on it. So you don't know who could go in and out of that room all day long. So don't bring anything that you wouldn't want to get lost, stolen, or broken. One final thing I wanted to bring up in this video is Pack your stuff the night before. Get your clinical bag ready the night before. Because at 5 a.m. when that alarm clock goes off, you're gonna be tired, you're gonna be out of it. You don't wanna be scrambling to get things. You'll be late to clinicals, which would be bad. You could forget something important, which would be bad. And a lot of times the instructors aren't gonna be very lenient on you. If you came to clinical unprepared, you don't have your stethoscope, go home. If you came to clinical 15 minutes late when you're supposed to be there 15 minutes early, go home. You don't get to have clinical today. So a lot of them are really strict, and that's for a reason, because they want you to learn how to be professional. You wouldn't be able to do this if it was your regular job, right? If you were already graduated and you were a nurse and you just said, oh, I don't have my stethoscope today, right? That wouldn't be a good thing. So making sure you have all of your stuff packed, ready to go, prepared, that way you can just grab it and go, you can be on time, and you won't get in trouble. So that was my video on what to bring with you to clinical. I hope you found this helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one.